There's been a lot of discussion about contact tracing to help curtail the spread of the coronavirus outbreak. But in this era of advanced technology with global tracking and digital locators, the process for tracking the virus may require old school techniques. ProPublica's Caroline Chen took a deep dive into contact tracing and joined me recently to discuss what may be coming. Caroline, let's talk about contact tracing. This is not that new an idea, but it's very different in how much we need it today.
Yeah, absolutely. We have been actually using contact tracing for decades and decades for many different types of diseases, including STDs like HIV and syphilis, and for diseases like tuberculosis. But the big challenge right now is just how big the coronavirus outbreak is. So what the US needs right now is massive numbers of people to do contact tracing.
And is this a job where they're going to have to go door to door because people are concerned that, hey, I don't want to actually be a contact tracer if I'm going to have to go meet people who are sick?
No, so this can all be done over the phone. And in fact, these can be remote jobs. So a lot of the states that are hiring people right now, this is a job that you can do from home.
That's great. Now, there's also been conversations about, for example, apps that would do this. What's the difference between if you were contact tracing in an app or what does a contact tracer do over the phone?
Yeah, so maybe let's start with how traditional contact tracing works and how a lot of public health departments are going to do this. So public health departments will get information from labs on positive patients. And so they'll get the information, say, that Bob has gotten a positive test. So they'll call Bob, hi, they'll check up on how Bob's doing and what his symptoms are. And then they'll also ask, hey, can we review with you who you've been in touch with? And the CDC guidance right now is 2 days before you started to get symptoms, because that's the period in which you were probably most infected. And the definition of a contact, according to the CDC right now, is someone who you were within 6 feet of for more than 15 minutes. And then they'll ask, do you remember people's phone numbers? This is why they're called disease detectives as well. That's another word for contact tracers. You really have to do some sleuthing here. And they'll get that information and then start contacting these people who were close contacts with Bob. Now, they don't ever actually give Bob's name, though. So there's this level of anonymity where they'll call then, say, Jane, and say, hey, Jane, we have information that you were within close contact of someone who tested positive for the coronavirus, and ask Jane to then be in quarantine for 14 days. Now, you asked about apps, and I think that digital apps are still something that is being explored at this point in time. But the idea there is that, if enough people downloaded an app, that they could, without taking down your location data, so then later on, let's say, if I voluntarily key in the information that I tested positive, that there had been an anonymous log of which phones had been within a certain distance of each other. But at this point, these are still being explored. And I think the main thing that the experts who talked to me said is that these would be most useful if this technology was working hand in hand with public health departments as a supplement, as opposed to something that was working sort of off on its own, independent of public health departments.
So, give me an example of the scale of contact tracers that we would need to pull this off, considering that our data shows that there are still new infections, officially recognized and diagnosed ones, that are happening every day.
One statistic that's really stuck in my mind is that the city of Wuhan, China, has about 11 million residents, and at the peak of their infection, at one point they had 9,000 contact tracers, and that's a ratio of 81 contact tracers per 100,000 residents. Right now, in the US, so if you take Massachusetts saying that they want to hire 1,000 contact tracers for their state, that would be about 14.5 contact tracers per 100,000 residents. So that's a much lower ratio. I think the highest that I've heard is California says that they would hire up to 20,000 contact tracers. So that'd be in the range of about 50 contact tracers per 100,000 residents. So still not up to Wuhan levels, but much higher. So basically, I think the takeaway is we need a lot more.
What do I need if I want to be a contact tracer, considering there are a lot of people that are unemployed right now, that might be looking for work that they can do from home. This sounds pretty good. What kind of qualifications do I have to have?
A lot of experts have said that you really don't need more than a high school diploma in terms of the actual basic contact tracing work, though of course you would need a report to someone who has a lot of public health experience in terms of leading the teams, or for more complex contact tracing work, say in a nursing home or a more tricky situation. A lot of people have compared it to, like census taking type of jobs. It's sort of a similar level of education. And I've looked, state by state, different states have different requirements. So I would say you really probably want to go look at your specific state's requirements. But I think, what really struck me when I was talking to people who have done contact tracing work, and I've talked to people who have organizations that do work in Liberia, I've talked to epidemiologists who have worked in Bangladesh, who have worked in the US, in Baltimore, is the hardest part of this job is not just data collection, but really empathy and getting trust from the person on the phone, because you're calling someone and oftentimes you're giving them really bad news. You're telling them either you're infected or you've been in close contact with someone who's been infected, and it's a real shock. And the thing that states really need to think about is you're not there to just extract information from someone, but you're there to then equip and enable someone to be able to comply with what they then need to do, which is stay at home for a relatively long period of time. So someone might say, I'm the only breadwinner in my household, or I can't get groceries, or I need medication. So you need to have social services engaged. You need to have this person trust you and understand why it's so important to break the chains of transmission. And so really people need to be trained in communication, do that job well alongside being able to gather good information.
Caroline Chen at ProPublica, thanks so much.
Thanks for having me.